Hey, it's Roy again, and today I'd like to talk a little about intimacy disorders. Well, what are intimacy disorders anyway? Well, I like to define intimacy disorders as any personality or behavior traits that get in the way of you developing and maintaining your relationships. It's that lack of ability to get close or stay close in your relationships. That's really the essence of what intimacy disorders are. Within intimacy disorders, you'll find four main types, and I'll review each of those quickly with you. The first type is called sexual anorexia. Sexual anorexia is where there is just an absolute obsession with avoiding sexual contact in your life. The practice of avoiding sex dominates your thoughts and dominates your actions. Classic symptoms of sexual anorexia: a dread or fear of sexual experiences, fear of upcoming sexual contact, disgust with features or physical features of your spouse, an obsession or a hypervigilance around sexual matters. Sexual anorexia takes over the point where it just becomes impossible to maintain a healthy relationship because that physical component of intimacy just is not allowed to happen within the relationship. Ultimately, it just causes the decay and destruction of the relationship as that facet of your intimacy dries up and disappears altogether. It causes great chaos and almost makes it impossible to carry on any kind of long-term, non-abusive relationship. The second type of intimacy disorder is what's called love avoidance. And love avoidance might be classically what you think of is that terminal bachelor, the guy that dates a lot, never settles down, can never get married, he can never get close. That might be the classic example of the love avoidant. The tendency of the love avoider will be to disconnect or to avoid any sense of real intimacy, any sense of closeness. It's almost like they'll create a bubble around themselves to protect themselves from either them getting too close to people or people getting too close to them. A classic example of a love avoidant pattern would be one spouse trying to communicate with the other about something important, something emotional, something something very, very critical to the relationship. And as the one partner tries to do that, the other person will create barriers to that conversation. They'll either minimize the importance of what that person's trying to say. They'll deny what that person to say. All those don't work, then this person will run. They'll flee from the scene. It'll be too much for them to handle. It'll be too intense. They have to get away from that conversation. So the results are either A, they're going to attack back and try to drive that person away, or B, they're going to retreat so that that person can no longer pursue them again, to create that sense of safety from touching something that's just too close, from being too close to another person. The third type of intimacy disorder is love addiction. The tendency of the love addict is to stay in a relationship despite the fact that it's abusive, out of fear of being abandoned. The fear of being alone is so great that the love addict is willing to tolerate emotional, physical, sexual, even spiritual abuse at any cost to avoid losing that relationship. The fourth form of intimacy disorders is sexual addiction. Sexual addiction being an obsessive compulsion revolving around sexual behavior where it takes over and inundates your life. All of your thoughts, all of your actions are driven around unhealthy sexual activity. I think sexual addiction deserves its own separate diagnosis, and we would talk about it in a lot of other places here. Look, intimacy disorders, all of us are affected by that to some degree or not. The question is it to the degree that's affecting your life? Is it affecting the quality and the ability for your relationship to thrive? And that's when you know you really have an intimacy disorder. All of us are going to have some of the struggles that are found within each of the intimacy disorders. You know you have a problem when it's chronic, when it doesn't go away despite your attempts to make it go away. that's when you know you're going to need help. Very, very often, the source of an intimacy disorder is going to be a traumatic experience or series of traumatic experiences in the context of your relationships with your primary caregivers or events of loss that have happened in your life. An intimacy disorder can seem so powerful. It's like, can you ever overcome this? And the answer is yes. It's not an easy process. It's not a short process. It's not a painless process, but it's a rewarding process. We're talking about your life here. We're talking about your ability to enjoy healthy, meaningful relationships. We're talking about something significant here. It's worth the work to get those things. That's what the clients that have made it through the other side with me tell me.